Hi, I'm T.R. Reed. I'm a proud Coloradan, but recently I went around the world to take a look at how other rich democracies provide health care. And what I found is pretty disappointing. The fact is, all the other countries like us, I mean advanced, high-tech, free market democracies, all of them are doing better than the U.S. at keeping people healthy. All those other countries have better health outcomes than we do. They spend about half as much per capita. And get this, they cover everybody. There's only one industrialized democracy that doesn't provide health care for everybody, and that's the world's richest country, the United States. And yeah, you're right, we expanded health care recently under Obamacare, but you know what? Even if that law works perfectly as designed, it's still going to leave 31 million people uninsured. About 400,000 people right here in Colorado won't have health insurance. And that means in our state, there are people walking around with asthma or diabetes who can't get treatment because they don't have health coverage. In Colorado, there are kids going to school with an earache or a toothache because their parents can't afford health care. We shouldn't allow this. We ought to fix this. And we could. I know we could, because all those other countries provide health care for everybody, and I know the United States could do it too. Obamacare expanded coverage, but it didn't get us where we ought to be, and Obamacare, frankly, leaves us still with the most expensive, the most complicated, and the most inequitable healthcare system of any rich country. We need major surgery for our healthcare system, and so we've turned to a Colorado doctor to see if she can come up with a fix. That would be Dr. Irene Aguilar, a physician in Denver, who's a member of the Colorado State Senate and the leading voice in state government on health policy.
We're paying enough already to cover everybody, but we're just not doing it. But there is a plan. It's called ColoradoCare, and it would provide quality, affordable health care for everybody at less cost than what we're spending now.
You know, one thing I hate about health insurance in America today is this idea of narrow networks that the health insurance companies have come up with. They say, hey, you want to go see Dr. Jones? That's fine, we'll pay for it. But if you want to choose Dr. Smith, no, we won't pay for that, even if Dr. Smith has been your doctor for years. Seems to me the patient, not the insurance company, ought to be choosing the doctor and the hospital and the chiropractor, etc.
ColoradoCare will cover every doctor, hospital, physical therapist, all of the medical care that you need. And with ColoradoCare, it's the patient who will make the choice of what provider to see, not the insurance company.
This sounds good to me. I mean, your plan would cover everybody in Colorado. It would give us much bigger choice than we have now, and it would save us billions of dollars in administrative costs. We ought to do this. How can we get it?
We've tried to pass ColoradoCare through the legislature, but with the money in politics these days, there's just no chance. Fortunately, in Colorado, we don't have to wait for the legislature to get things done. The citizens can do it themselves through the initiative process. And that's what we're doing right now with ColoradoCare. We're collecting signatures to get it on the 2016 ballot so that we can have a comprehensive healthcare system in the state of Colorado.
You might ask, why do we need to do this in Colorado? Didn't our country just have a big change in health reform 5 years ago? Yeah, we did. And Obamacare did expand coverage, but it didn't get us to universal coverage. It's going to leave hundreds of thousands of people right here in Colorado without health insurance. And it's complicated, and it's expensive. There just ought to be a better way. Now, one good thing about Obamacare is it gives states the right to waive out of Obamacare. If any state, right, it says right in the law, if any state comes up with a system that covers as many people just as well as Obamacare, you're out of the Affordable Care Act. No mandates and no penalties imposed by Washington. This sounds good to me. Let's let Colorado design the plan rather than bureaucrats back in Washington, D.C.
Section 1332 of Obamacare is known as the state opt-out section, and this would allow us to design our own Colorado system. What we would have to do is meet 4 criteria. We'd have to be sure that we cover at least as many people, that the coverage is at least as comprehensive as you get in the Affordable Care Act, that it doesn't cost people more, and that it doesn't raise the federal deficit. And we've had a fiscal analysis done of ColoradoCare, and it easily meets all of those criteria.
You know, this is sounding good. It sounds like this Colorado Care plan has a lot of benefits for our state.
You're absolutely right. It covers everybody, it saves billions, and it lets the patients themselves choose the doctors and hospitals where they will get their care.
And it gets us out of Obamacare.
That's right. We can design a system right here in Colorado that's better than anything they can design in Washington, D.C. That's why I keep telling people that if you vote against Colorado Care, you're voting for the status quo. With Obamacare, we leave hundreds of thousands of people without health insurance, and they can't get any medical care until they're sick enough to go to the emergency room. We can do better than that with Colorado Care. We can provide quality, affordable health care for everybody, and we can save money. What's not to like about that?
If Coloradans approve this ballot initiative, we'll be doing a great service for our state. But it's also an important service for our country. Because when we show that Colorado Care can work, the other states will follow our lead, just like they followed Colorado's lead on policy ideas like marijuana and fracking regulations. And then finally, the United States will get where we should have been a long time ago. We'll have high-quality health care at reasonable cost for every American.